Hi, my name is Dr. Ben Binder-Markey. I'm an assistant professor in the Department of Physical Therapy and Rehabilitation Services.
And I am Dr. Laura Baehr. I am also an assistant professor in physical therapy and rehabilitation sciences.
Yeah, so one of the big trends within the physical therapy industry is really the incorporation of technology. Everything's talking about AI right now, but also advancements in devices and technology, kind of like exoskeletons, VR headsets.
I think relating to that is the movement toward incorporating telehealth, because as we know from the pandemic where we were forced to be at a distance, now there's actually a lot of really great benefit from an access perspective. And then there's also the question of who actually is that access benefit for. And so in the field, we're really having a lot of conversations, not only from an ethical perspective, but also from a reimbursement perspective, if we are going to start to take our treatment from a remote perspective with that telehealth.
And then also now we're starting to be able to actually explore a little bit and get more into that personalized and precision medicine, where we're looking at individuals' genetics as well as their epigenetics and how that really affects their kind of course of treatment. And again, going back to those ethical questions about how to bring that into the clinic and how to determine how that will affect their treatment further moving down and their prognosis. It's kind of really starting to be, I would say, like an emerging trend.
That is a very easy question. So I wanted to come back and be a professor here at Drexel after completing my PhD in the Health and Rehabilitation Sciences program, because Drexel has a really great culture of innovation. Everyone here who I've interacted with and now being part of faculty, when there's a question in the room, it's how do we solve it, rather than putting up blocks as to what are the problems and why we can't solve it. And I think that's a really great quality and thinking very much about the future. And I wanted to be in a forward-thinking place.
There are many opportunities to actually get involved with research from the undergraduate all the way up through professional DPT degree. I actually have multiple undergraduate students within my lab. Some are from biology, some are from nursing, so they can get involved as early as their freshman year. We also have independent studies that they can then get involved with, but all of the research faculty are very much willing and want to take students within their labs to be able to push them forward, as well as be able to really kind of get that early experience of research.
Research is a word that conjures up different thoughts of what that actually means. And what we're really proud of within our program is that we offer a lot of different things that can all fall under that research umbrella, anywhere from mechanistic work or looking at muscle biopsy, all the way up through thinking about how can we actually engage community partners to get more active in their communities. So lots of different opportunities here.
The Department of Physical Therapy has a long history of research. We have research that spans from kind of your mechanistic lab-based research all the way up to population research, as well as we have research that goes across the entire lifespan from pediatrics to geriatrics.
And I can even share one project that actually was ongoing from when I was a student and is now continuing and has grown. One of the other physical therapy and rehab sciences faculty, Dr. Margaret Finley, and I worked together to create a group exercise intervention for people with spinal cord injury. And we found that it was safe and feasible, and we have really nice results to show that when people participate in this program, it improves their physical activity behavior, but also the things about what they think about physical activity that's going to make them do it in the long run. So the physical therapy program being housed in the College of Nursing and Health Professions is a huge benefit to students because of the number of interdisciplinary opportunities that are afforded here within the college. You could be working with nursing students, you could be working with folks in nutrition, you could be working with folks in creative arts therapy and additional programs. So while you might not be in the classroom with those students, if you were a physical therapy student, you may be able to go to a seminar and work with them, or maybe collaborate on a research project with them across with the faculty. And then of course, within our PhD program, we also have the opportunity for those students to be in the classroom with the other programs.
So some of the careers that you could go into, the traditional path is be a practicing physical therapist out in the clinic day in, day out. But you can also, as we both did, you can kind of transition into academia, do teaching, do research. But also you can actually go with the emergence of wearable technologies. Many tech companies are actually starting to hire PTs to come in and kind of be that clinical background, be that clinical input Really, the possibilities are endless being a physical therapist. You have that clinical background, but that doesn't mean you have to stick with just treating patients. You can go a step further.
We're movement experts, so any way that you can incorporate movement into a job, which frankly is everything, physical therapists should be there.